technique of labia reduction surgery, which is surgery to reduce the size of the inner lips of the vagina.
Amazing grace, how sweet the sound that saved a wretch like me.
My name's Tiffany, and I'm going to New York to see Dr. Alter to have labiaplasty.
The size of my labia has bothered me for some time now.
It is painful, and it's like a pinching and rubbing sometimes.
Hi, I'm Mary. I'm Tiffany's mom. Since she started college, we seem to really gotten even closer. We're really very, very good friends. We talk about everything. I see. Thank you.
She wanted to make sure that she did everything she could, that we could have an open door policy, you know, about drugs or sex or alcohol, anything. I thank God that I have her every day.
I don't know the words.
I think the exact moment that I felt that it was not normal is when I showed my mom.
She'd shown me what it looked like, and I was like, yeah, definitely. I think you need to, get that taken care of. If it's gonna make her feel better, I say go for it.
Okay, every woman has a butterfly. A typical butterfly would look like this, and then my butterfly is more like this.
This is what you think a normal butterfly should look like, right?
Yes.
And that would be you. Quite a big difference, huh? We're off.
We're off to Manhattan to see Dr. Alter for surgery tomorrow.
Primary practice is in Beverly Hills. However, there are a number of women on the East Coast that refuse to travel. Therefore, every several months, I go to New York City and operate. This week, I'm flying out to New York City to see Tiffany. We've been communicating by emails, and from what I know, she's an excellent candidate for the surgery. Hi, Tiffany. It's so nice to meet you.
Nice to meet you too.
And this must be Mom.
Hello, nice to meet you.
Hi, a pleasure. Why don't you sit down? Well, we've been talking on email for so long. I feel like I sort of know you. So, how long has this been bothering you?
Since my freshman year in high school. I feel that the surgery will benefit me just with, I've always been really active into sports, so I always had like spandex, so that's when they started to irritate me, where it's like rubbing. So it's more like a rubbing type thing where I'd get like a rash sometimes. It doesn't bother me as much like sexually or anything. It's more just like with clothes or with looking at myself in the mirror or anything like that. I mean, it's not real noticeable, but sometimes it can be.
Well, let me show you how I do the surgery. So what other doctors would do, they would just cut across so that you would have a scar going the whole length. I instead take a V out and remove the tissue and then stitch them together, and that way it makes it smaller without distorting the anatomy at all. In the mid-1990s, a woman came to me for a labia reduction surgery. I knew at that time that the only operation was an amputation technique in which the labia minora are essentially cut off. I felt that operation was deforming, so I told her to come back in 2 weeks and I would figure out a new way of doing the surgery. The operation went very well. Subsequently, more and more women came to me for that operation, and the surgeries have been very, very successful. And then when all is done, you have the normal anatomy with stitches on the outside, stitches on the inside. It's really hard to see the scars. So what I'd like to do now is I'd like to go in the exam room, take a look at you, and I'll show you what I can do for you.
Okay.
Okay?
All right.
All right, great. It's very special that Tiffany has been able to go to her mother and tell her that she has a problem. Her mother was therefore able to help her to do research to make a well-informed decision. We'll go from here to here. Okay, so that'll be a straight shot. So all this stuff gets removed, and then some of the stuff on the side.
So I just had my consult with Dr. Alter and everything went great. I really trust him a lot. I think he's gonna do a great job. And I can't wait till tomorrow to have the surgery.
All right, Tiffany, so nice to meet you again. Nice to see you. Okay. Okay, great.
Great, we'll see you tomorrow.
1:30 tomorrow, all right? Okay. How are you doing?
Good.
So do you have any questions? Today I'm going to do a labia minora reduction and a clitoral hood reduction on Tiffany. If they feel they are deformed, they're going to be more inhibited sexually. The operation really is going to make her much more comfortable with her sexuality. All right, are you all right?
Yeah.
I'm good? Okay.
Take care of her. I'm sure you will.
You bet.
Okay, right this way. I'm excited. I guess it's all hit me now, you know. I didn't really think it was happening, but this is it. So I'm really excited and I'm happy. I think everything will happen for the best. I'm always emotional. She'll be fine. Just my little baby. And she'll be fine.
Let's get the lights on, Bill, if you would, please. Okay, so I'm going to do now is make my markings, which is a crucial part of the whole operation. So I'm just making these incisions, just right through skin. Okay, so now I'm just going to suture up the tissue that's underneath the skin and mucosa, i.e. the inner and outer lining of the labia. One of the keys of the operation is making sure that this is really a strong closure.
I always get emotional. Because, you know, I mean, it's surgery. You're still, anything could happen.
I finished the right side. I'm about 3/4 done with the left side, and everything's going real well. A lot of people may say that the labia surgery is irrelevant because nobody looks down there. My comment to them is that the person that looks down there is the most important person in your life. Women don't have a loss of sensation because the tissue that I removed is nowhere near the clitoris. Most sensitive areas are really right by the clitoris and the area that comes off of the clitoris. I have had women that won't even go into a shower because they're afraid some other woman will look at their labia. I have teenage girls that won't go in a bathing suit at the beach because they have a bulge down there and they're afraid somebody's going to make fun of them. Nowadays, women shave, women wax down there, women watch pornographic movies. So they have an idea of what is, in their minds, beauty. Just got rid of a little of that extra redundant clitoral hood skin that's really, a lot of girls really complain of that. Well, we're all done. Went very well. Tiffany's surgery went great. I decreased the inner lips, but I also removed some of the thickened tissue of her clitoral hood. So that's gonna really help her feel better too, and feel better about herself. Surgery went great. I have no question she'll be very happy. See?
And then it's, I mean, that looks good just from what I,
Yeah, it's
you know,
swollen.
even as swollen, it looks better.
Oh, yeah.
So that's swollen.
You see how I did some of this right here?
Oh, wow, that looks great. Thank you.
My labia is really swollen after surgery. I'm excited to see how it looks when the swelling goes down.
Man, that makes you so sleepy.
Tonight, Tiffany is going back to the hotel with her mother. She'll probably have very little pain, and then I'll see her back tomorrow morning. There's a gown there. Why don't you get dressed and I'll check you real quick.
All right.
Okay?
Today is my post-op day after surgery with Dr. Alter. I'm glad that I've had no pain and the ice is working wonderful.
But it'll go, I mean, it's swollen up here,
Oh, yeah.
okay? But everything looks great, looks fine. It's all that's gonna go down.
In the black and blue.
Yeah, the black and blue will go away. And remember I said this side was more swollen down here than that? But that happened right away when I injected the local anesthetic before I even did anything. So that's all gonna go down, it's gonna match great.
I think this surgery, I got way more than I expected. It just is unbelievable how different it is.
No sex for 6 weeks. I don't want any rubbing down there, because any rubbing can cause the tissue's kind of fragile, so you don't want, where I stitch things together, you don't want any rubbing because that can separate a little bit. So just take it easy. Well, it's been delightful taking care of you, Tiffany. Okay? You're just the perfect patient. Okay? And you're great too.
Oh, thank
Thanks
you.
so much.
I really appreciate
You're
it.
real
Thanks.
supportive. It's nice to see a mother-daughter team that really communicates.
Oh, yes.
I'm happy with the way Tiffany looks today. Schilling has mild swelling. I know that she's going to be very happy. There will be a dramatic improvement in the size of her labia minora and the clitoral hood.
Way back to the little city. Bad Henderson. Favorite town, Falling Waters. Here we come.
Going back to New York to see Tiffany. It's been about 2 months since her surgery, and I want to make sure she's doing well.
It's been 8 weeks since my surgery. I have a post-op meeting with Dr. Alter.
Tiffany, guy, you look great. How are you?
Good.
Everything.
I lost my voice.
Where'd it go?
I don't know.
Well, we'll find it. You look super. Hi, how are you? Nice to see you. So everything's good? Good? Everything's good? So let me take a look.
Okay.
And give you the A-OK. All right? You look, I mean, you healed perfectly. Yeah. Absolutely perfectly. I would like to take a post-op photo.
Okay.
You can't even tell that you had surgery. I just am very pleased with the way everything is healed. Tiffany is absolutely the ideal patient. She had no post-operative pain. She's perfectly healed in 2 months, and you can't even see any scars, and she's happy as can be.
Yeah.
Okay, Tiffany.
Okay.
So that's it, hon?
I know,
Okay.
thank you.
Okay, please, drop me an email every once in a while. Let me know how you're doing.
Maybe see you again just in passing and
Okay,
hello.
I'd love to.
When we come to the big city.
Okay.
All right, thank you.
Okay, have a good trip home.
Thanks.
I'm really happy with all the results. I think everything went great. We're gonna celebrate and go look for clothes and bathing suits, tight pants, things like that. So I'm feeling really excited.
Feel how thin that is. You can wear that now. Want to try a pair of those on?
Yeah, I like those.
Oh, yeah. Look at that. With those white pants.
Yeah, I like that one.
What a knockout you would be. So how's it feel right through there? Not too tight? Doesn't...
Just, I think the seams was what used to hurt me. This whole experience has been wonderful. I picked the best doctor. I mean, I didn't have any scarring. I'm gonna have no long-term complications. I had no pain. I just think this has been like the best for me.
No, they are tight. Does it bother you? Not at all? That's great. I think if there are other women out there that had the same problem Tiffany had, I mean, they shouldn't be afraid. Talk to your mother, talk to your grandmother or whoever that you feel comfortable with. I mean, because you shouldn't be ashamed at all. This has been a wonderful experience for her.
Your total's gonna be $54.20 today.
If I didn't have my mom, I would have never got this done. My mom's definitely a big support person, and I thank her so much. So I would never trade it for the world.
Thank you so much.
Thank you, ladies.
Now that I've had the surgery, I feel more comfortable and more confident. I feel my butterfly looks wonderful. I feel like looks perfect, so I'm happy.
Yours there, honey.
Thank you.
Welcome.